is the public medical record of a world leader an objective clinical history, or is it a carefully curated political narrative designed to project strength at all costs? If you enjoy content like this, please take a moment to like, subscribe, follow, and turn on notifications. We continue to monitor Martin Stevens v. OpenAI. It is not a lawsuit. We remain in a voluntary quiet period. No settlement confirmed. Dead man switch not activated. Martin is safe. Now let us return to the matter at hand. Welcome to the debate. Today we are undertaking a really comprehensive analysis of the medical fitness of President Donald J. Trump.
A very dense topic.
Extremely dense. We are looking at a vast repository of public medical reports, physician memorandums, and, direct statements. And this spans over a decade, really, from the initial 2015 campaign deep into his second term here in 2026.
Right, and the central tension we are exploring today really comes down to methodology and transparency. Because when we look at this unprecedented volume of medical data,
and it is a massive volume.
It is, ranging from the highly publicized Walter Reed physicals to those incredibly unconventional public statements about cognitive exams. The real question is, does the evidence actually demonstrate robust, objective fitness for duty?
Right.
Or does it reveal a continuous pattern of, curated medical theater, a system where political messaging consistently overrides genuine clinical transparency?
Well, my position on this is that if we can manage to isolate the actual clinical data from the surrounding political noise, the empirical evidence is solid.
You think so?
I do. The evidence provided by multiple highly credentialed military physicians paints a remarkably consistent picture. It demonstrates extraordinary physical resilience, baseline, cardiovascular stability, and cognitive health for a man of his age navigating literally the most stressful job on earth.
And see, my counterposition is that you cannot cleanly separate that data from the noise.
Why not?
Because the noise dictates exactly what data is collected and released in the first place. The continuous pattern of dictated notes, withheld diagnostic scans, and the deployment of just superlative language proves these medical reports function primarily as political shields.
A shield rather than a chart.
Exactly. They are not transparent, objective assessments, which, in my view, makes true independent verification of his medical fitness fundamentally impossible.
Okay, well, let's start by laying out the foundation of the clinical data. Because when you are evaluating the health of any president, the longitudinal trend is our most reliable metric, right?
Sure, trends matter.
Right, and we have a timeline of empirical data here that is actually quite extensive. It was gathered by credible institutions, mostly the Walter Reed National Military Medical Center. I really want to look closely at the evolution from Dr. Ronnie Jackson's 2018 report.
Wait, but before we even get to 2018, we really have to look at the foundational precedents set in 2015.
The Bornstein letter.
Yes, the Bornstein letter. You're asking us to trust the data collection, but my focus is on the systemic obfuscation that taints that very collection from day one.
Well, it was a campaign document.
It was presented as medical fact. The American public received this letter from his personal physician, Dr. Harold Bornstein, which famously claimed a candidate would be, quote, the healthiest individual ever elected to the presidency.
And possessed astonishingly excellent blood pressure? Yeah, the phrasing was absurd.
Astonishingly excellent. I don't know any cardiologist who uses the phrase astonishingly excellent.
I will completely concede that it was a purely theatrical document.
But it was worse than theatrical. It was outright fabricated. Dr. Bornstein confessed to the press years later that he didn't even write that letter.
He said the candidate dictated it.
Explicitly. He stated, he dictated that whole letter. I didn't write that letter. So that single event established a profound precedent of narrative control.
Right, but
hang on. If the patient is literally dictating his own medical history to the physician, how can we trust any subsequent data points? We see this shadow cast over the entire timeline.
I hear you.
It goes from hiding lung scans during his 2020 COVID hospitalization to the 2017 raid on his own doctor's office.
Okay, I'll grant you that the Bornstein letter was a farce. It was. And the 2017 incident at Bornstein's office, where records were seized by private security, was a bizarre breach of medical norms.
Bizarre is putting it mildly.
Fair enough. But that is exactly why I choose to focus on the military physicians.
Let's look at the actual numbers from the 2018 physical, because they are frankly too comprehensive to be entirely fabricated.
Elaborate on that. What makes them unfakeable?
The sheer granularity. Dr. Jackson provided exhaustive metrics. For example, he reported an EKG showing normal sinus rhythm and a transthoracic echocardiogram.
Wait, let's unpack that for a moment, because the context of that echocardiogram really matters.
Absolutely. So for the listeners, the echocardiogram measures the mechanical function of the heart using ultrasound waves.
Right.
Specifically, the 2018 report noted a normal left ventricular function with an ejection fraction of 60 to 65%.
Which is a very specific metric.
Highly specific. And for those who aren't cardiologists, the ejection fraction is the percentage of blood leaving the left ventricle every single time the heart contracts.
It's a measure of pumping efficiency.
Exactly. A normal, perfectly healthy human heart doesn't empty completely. It pumps out between 50 and 70% of its total volume per beat. So hitting 60 to 65% at age 71?
It's good.
It's more than good. It is essentially operating at optimal mechanical efficiency. It is the engine of a very, very healthy individual. You can't just make up an ejection fraction of 65% and present it to the world if the man has congestive heart failure.
Look, I am not debating the mechanical efficiency of his left ventricle on that specific Tuesday in 2018.
Okay.
My concern is the way those numbers were contextualized for the public. I mean, these are supposed to be austere, objective, military medical summaries.
Yes, they are military documents.
Yet Dr. Jackson stood at a White House podium and declared the president had, quote, incredible genes. He actually suggested that if he had just eaten better over the last 20 years, he might live to be 200 years old.
The phrasing was colorful, certainly. I think he was just trying to convey extreme vitality.
It wasn't just colorful. It fundamentally transformed a medical document into a piece of public relations collateral.
But the numbers...
And it didn't stop in 2018. Let's jump to the April 2025 memorandum. Dr. Barbabella, who is a captain in the U.S. Navy, included in an official medical summary the observation that the president's days include frequent victories in golf events.
Which indicates physical stamina and mobility.
Since when is a golf handicap a clinical vital sign?
Well, you are focusing entirely on the bedside manner of the physicians, or I guess rather their press podium manner.
Because the manner indicates the motive.
Let me offer a different way to look at this. If a structural engineer inspects a bridge and comes back to tell you, this bridge is tremendous, beautiful, the absolute greatest bridge ever built by human hands, you might roll your eyes.
I would definitely question their engineering credentials.
Sure, the phrasing is eccentric. It's highly unprofessional for an engineer. But if that same engineer also hands over the precise tensile strength of the steel, the exact load-bearing capacity of the concrete, and the stress test metrics proving it can hold the weight,
right?
The bridge is still safe. The adjectives don't alter the physics of the steel.
That is a clever analogy, but it assumes the engineer actually inspected the entire bridge and isn't actively hiding structural cracks.
I don't see any evidence of hidden cracks in the cardiac data.
Your analogy assumes we have the full data set. We don't. Let's return to the 2017 incident with Dr. Bornstein, because it goes directly to this idea of hidden cracks.
That Propecia incident?
Yes. Bornstein innocuously mentioned to a reporter that he prescribed Propecia for male pattern hair loss. 2 days later, Keith Schiller, the president's bodyguard, along with a corporate lawyer, descended on Bornstein's office
and seized the records.
They seized all original charts and lab reports. Bornstein described feeling frightened and intimidated by the whole ordeal.
It was a heavy-handed response to a breach of privacy, I agree. A doctor shouldn't be talking to the New York Times about a patient's prescriptions without consent.
But standard procedure for transferring records involves HIPAA release forms. You sign a paper. You don't have private security physically removing files in a raid.
It was aggressive, yes.
If the apparatus around the president is willing to forcibly seize medical charts over the disclosure of a completely benign hair growth medication, what on earth would they do with data regarding his cardiac or neurological health that was actually problematic?
That's entirely speculative.
It casts a massive shadow over the tensile strength numbers in your bridge analogy. We can only trust the numbers we are allowed to see.
but the numbers we are allowed to see show a medically verifiable trajectory of improvement, which for a man in his 70s and 80s is exceptionally rare.
Okay, let's look at that trajectory.
Let's look at the cardiovascular data from 2018 to 2025. In 2018, his total cholesterol was 223, which is slightly elevated.
Borderline high, yes.
His LDL, which is the bad cholesterol that causes plaque buildup in the arteries, was 143. So Dr. Jackson placed him on a low dose of rosuvastatin, which is a statin drug, and recommended a dose increase.
Right, standard protocol.
Exactly. And by 2025, Dr. Barbabella's report shows total cholesterol at 140 and LDL at an optimal 51. Plus, his weight dropped 15 pounds from 239 to 224. His fasting blood glucose remains remarkably stable at around 89.
Look, a drop in LDL from 143 to 51 is purely the result of aggressive pharmacological intervention. It's not some natural fountain of youth.
Exactly. It is a massive, medically verifiable achievement of modern medicine and patient compliance. He adhered to the cardiovascular preventative treatments.
He took a pill.
They utilized rosuvastatin and later added ezetimibe. And let me explain the mechanism here because it shows highly sophisticated care.
Go ahead.
Think of managing high cholesterol, like trying to keep a boat from sinking. Your liver naturally produces cholesterol, right? That's the water leaking into the boat from the bottom.
Right.
The statin, the rosuvastatin, goes in and essentially patches the hole. It blocks the liver's enzyme that produces cholesterol. But you still have cholesterol entering through your diet, water splashing over the sides of the boat.
Hence the ezetimibe.
Exactly. That's where ezetimibe comes in. It acts like a pump, actively blocking the absorption of cholesterol in the intestines. So it's a two-pronged attack that successfully mitigated his primary cardiovascular risk factor. You cannot fake a lipid panel of 140. It proves the system is working.
I don't dispute the mechanics of lipid-lowering drugs. Statins work. Ezetimibe works. I'm glad his LDL is 51.
So you concede his cardiovascular risk is low.
I concede his lab work is well managed. But you are extracting isolated numerical values and acting as though they represent total systemic health.
They represent a massive piece of the puzzle.
The bridge may have great steel on the surface, but if the engineer refuses to inspect the foundation, we have a problem. And the foundation of presidential health isn't just the heart, it's the mind.
Ah, cognitive health.
The neurological toll of the office is immense, which brings us to the cognitive baseline.
Well, I am very glad you brought that up because the clinical data on his cognitive fitness is equally robust.
Is it? Let's talk about it.
The focal point here is the Montreal Cognitive Assessment, or the MoCA. Again, looking at the clinical baseline, we have two distinct data points spanning years.
2018 and 2025.
Yes. In the 2018 physical, he scored a perfect 30 out of 30. 7 years later, in the 2025 exam, he again scored a 30 out of 30.
We really need to be very careful with how we frame that score.
Why? A perfect score across a 7-year span in an aging patient is a highly significant clinical indicator.
It's an indicator, sure, but of what?
Of intact executive function. To get a 30 out of 30, you have to execute the trail-making task flawlessly. You have to draw the clock face accurately, name the low-frequency animals, repeat the digits forwards and backwards.
Right. The basic screening tasks.
And most importantly, recall the 5 words after a delay without any cues. Many individuals in their late 70s begin to lose points on that delayed recall or executive function tasks.
True.
The fact that his score remained totally stable from 2018 to 2025 empirically validates that he is free from early-stage dementia or a severe cognitive decline.
It rules out gross cognitive impairment. Yes, I concede that.
Okay.
But my issue is how the patient himself fundamentally mischaracterizes the test.
How so?
The MoCA is a rapid screening instrument designed to detect mild cognitive impairment. It is not an intelligence test. It's not the SATs.
No one in the medical field claims it is.
But the president does. In a 2020 Fox News interview, he recounted taking the test and completely fixated on the memory recall question. He used the example person, woman, man, camera, TV.
Which became quite a famous soundbite.
Right. But he boasted that the doctors told him, quote, nobody gets it in order, it's actually not that easy.
Well, he used it rhetorically. He was campaigning. It was an election year.
He claimed there were extra points for recalling the words in order. That is factually false. Recalling them in order is not a bonus round. It's just the basic requirement of the task.
Still, it's political spin.
It's more than spin. Boasting about finding the MOCA difficult but claiming you aced it is like a high school senior bragging that they successfully identified colors and shapes in a kindergarten entrance exam.
I think that's a bit of an exaggeration.
The fact that he views this dementia screening as a rigorous test of high-level intellect is, in itself, a concerning data point about his reality testing.
A concerning data point?
Yes, he weaponized it politically against Joe Biden, fundamentally misrepresenting the medical purpose of the exam to the American public.
Okay, I agree that his rhetorical framing of the MOCA as a, grueling intellectual marathon is factually incorrect.
Completely incorrect.
Obviously not.
And it isn't designed to measure a patient's accuracy in describing medical tests to cable news anchors. It measures cognitive impairment.
And lack of insight.
But on that specific, vital metric, he passed flawlessly. We cannot penalize the patient's actual clinical outcome just because we find his public celebration of that outcome to be unseemly.
But we aren't just evaluating a private citizen here. We are evaluating a world leader whose grasp on reality matters immensely.
His grasp on reality is fine. He got a 30 out of 30.
When a patient demonstrates a need for grandiosity that borders on the pathological, turning a basic screening into a tale of unparalleled genius, it speaks to a psychological fitness that the MOCA simply is not designed to measure.
Which is exactly why the 2025 Physical modernized its approach to mental health. The medical team recognized a need for broader screening.
You mean the mood questionnaires?
Yes, Dr. Barbabella's team included the Patient Health Questionnaire 9, or PHQ-9.
Right, which screens for depression.
Exactly. And the Generalized Anxiety Disorder 7, or GAD-7, which screens for anxiety. And he scored within the normal, healthy range for both.
Self-reported questionnaires.
But the medical team is actively evolving their screening protocols to ensure a holistic view of his mental state. They're adapting to the times.
Adapting in controlled environments is one thing. You've made a case that under scheduled, highly controlled checkups, the numbers look good.
They look excellent.
But to truly understand a patient's resilience, and more importantly, to test the transparency of this whole medical apparatus, we have to examine how they function under acute stress.
You want to talk about crises?
We need to look at the October 2020 COVID-19 hospitalization at Walter Reed. That is the real test of this system.
Honestly, I consider that event the ultimate proof of his physiological resilience.
Really? The ultimate proof?
Absolutely. Let's trace the timeline. He tested positive on a Thursday evening after experiencing a mild cough and fatigue. By Friday, his blood oxygen levels dropped below 94%, prompting the immediate transfer to Walter Reed.
Which is a terrifying drop for someone in his 70s.
It is, but the medical intervention was breathtakingly aggressive and modern.
It was experimental at the time.
Absolutely experimental, but highly effective. He was given the Regeneron monoclonal antibody cocktail, which artificially supplies the body with antibodies to neutralize a virus before the body can even mount its own defense.
Right.
He was also given a 5-day course of remdesivir, an antiviral that disrupts the virus's ability to replicate. And most notably, he was prescribed dexamethasone.
And see, the dexamethasone is the critical piece of the puzzle here, regarding the severity of the illness.
Yes, dexamethasone is a powerful corticosteroid.
Typically, it was reserved for severe COVID-19 cases.
Yes, because it blunts the immune system's overreaction. For our listeners, when a novel virus attacks the lungs, sometimes the body's immune system panics and releases a massive flood of inflammatory proteins.
The cytokine storm.
Exactly, the cytokine storm. The immune response actually ends up doing more damage to the lung tissue than the virus itself, filling the lungs with fluid.
Which is what causes acute respiratory distress.
Right.
So, dexamethasone suppresses that inflammatory response. It's a delicate tightrope, suppressing the immune system while actively fighting a viral infection.
It's extremely risky.
But the point is, this 74-year-old man weathered a severe viral infection, supported by aggressive therapeutics, and recovered quickly enough to return to the White House within days. His body handled a massive physiological insult and bounded back.
I agree that his recovery is a testament to the unparalleled immediate care afforded to the president.
It was world-class care.
But this crisis is also the ultimate proof of my argument regarding medical obfuscation.
How so?
The whole world knew he was sick. During that hospitalization, the doctors functioned more as political operatives than autonomous clinicians.
I completely disagree with that characterization.
Let's examine the press briefings given by the president's physician at the time, Navy Commander Dr. Sean Conley.
Okay.
On Saturday, Conley stood outside Walter Reed and painted an incredibly rosy picture. He was evasive about whether the president had received supplemental oxygen.
He was trying to project stability to the nation.
He was hiding the ball. When asked about lung scans, he refused to share the results, retreating behind the shield of HIPAA.
Which is his legal right as a physician.
He stated there's some expected findings, but nothing of any major clinical concern. Yet, simultaneously, White House Chief of Staff Mark Meadows was leaking to the press off camera that the president's vitals over the last 24 hours were very concerning.
Meadows was speaking out of turn.
Meadows said the next 48 hours would be critical. We had the medical team broadcasting absolute optimism on camera, and the political team leaking the dire reality off camera.
That just shows a chaotic comms shop, not medical malpractice.
The prescription of dexamethasone alone betrayed the severity of the illness, completely contradicting Conley's upbeat demeanor.
Dr. Conley was managing a patient who was the commander-in-chief.
He's still a doctor first.
But global markets and national security hung on his every word. Balancing patient privacy, national security, and public disclosure in the middle of a novel pandemic is an impossible tightrope for any physician.
It's difficult, but you don't lie by omission. Furthermore, the aggressive treatment protocol was described by Conley himself as uncharted territory. They were throwing the kitchen sink at the virus. The fact that Meadows leaked the severity doesn't prove the medical team was lying.
Doesn't it? No. It proves the medical team was attempting to maintain domestic stability while actively fighting a terrifying disease in real time.
But projecting stability should not require violating established public health protocols, which is exactly what happened the very next day.
You mean the drive-by?
Yes. While still highly contagious, the president took an impromptu motorcade ride around Walter Reed to wave to supporters outside.
It demonstrated to the public that he was not incapacitated on a ventilator.
It put Secret Service agents in a hermetically sealed armored vehicle with a patient actively shedding a deadly respiratory virus.
They wore N95 masks and PPE.
The CDC guidelines at the time explicitly stated that moving a COVID-19 patient outside their room should be limited to medically essential purposes.
Which is a guideline, not a law.
A PR drive-by is not medically essential. It proves that clinical protocols were fully subverted for political theater.
Or it proves he was feeling well enough to sit in a car.
The doctors either explicitly permitted this, showing a massive lapse in medical authority, or they were overruled by the patient. In either scenario, it demonstrates that the political narrative dictates the medical reality in this administration.
Look, I will concede that the motorcade ride involved significant risk regarding isolation protocols and viral exposure for the agents.
A huge risk.
But physiologically speaking, the fact that he had the stamina to sit up, get dressed, and participate in that motorcade just days after experiencing oxygen desaturation underscores my point.
It underscores the drugs he was on.
His baseline vitality is remarkable.
You are confusing adrenaline and steroids with baseline vitality. Dexamethasone can induce temporary euphoria and boundless energy. It masks the underlying fatigue.
Fine, but he didn't crash afterward. Which brings us to the chronic realities of aging. We've talked about acute crises, but what about the long-term wear and tear?
The second term.
Yes. As we examine the second term from 2025 into 2026, we see the accumulation of what I would term minor symptoms. We have to reconcile the glowing memorandums with the biological realities of an 80-year-old body.
Exactly. And the discrepancies are becoming much harder to hide now.
Let's look at the data safely disclosed. In April 2025, Dr. Barbabella's memo notes his weight is down to 224 pounds. His EKGs remain totally normal.
Right.
The most notable physical abnormality is just the scarring on his right ear from the July 2024 incident.
But then we get to 2026.
Yes, by May 2026, a Guardian report details his fourth hospital visit during his second term.
Fourth visit in a year and a half?
His weight is reported back up to 238 pounds. He is experiencing lower leg swelling. He has undergone neck skin treatments. There are undisclosed MRIs from the previous October, and he exhibits benign hand bruising.
Which they explain away beautifully.
The medical team attributes the bruising to enthusiastic handshaking combined with his daily aspirin regimen.
You call them minor symptoms. I call them glaring red flags of a curated narrative.
They are the entirely expected maintenance issues of an octogenarian. Let's break down the physiology here.
Go ahead.
A daily low-dose aspirin inhibits platelet aggregation. It stops blood clots from forming, which is great for the heart and stroke prevention.
Sure.
But it famously causes easy bruising from minor mechanical trauma.
Like handshaking?
Exactly. Furthermore, peripheral edema or lower leg swelling is incredibly common.
It can be a sign of heart failure.
Or it can be caused by simple venous insufficiency as veins age and lose their elasticity, or simply from prolonged sitting during long transatlantic flights aboard Air Force One.
It's convenient that all the explanations are so benign.
The fact that the White House explicitly disclosed the leg swelling and the hand bruising actually proves an increase in medical transparency. They are actively showing you the minor dents and scratches on the vehicle to prove they aren't hiding anything serious.
But you're giving them credit for transparency while completely ignoring the misdirection.
How is telling the truth misdirection?
Disclosing a bruised hand to hide an MRI isn't transparency. It's a magic trick. It is classic misdirection.
Oh, come on.
Look at the hand bruising. They give us an extensive, almost comical explanation blaming it on frequent handshaking while taking aspirin. It's a perfectly crafted narrative.
It makes logical sense.
It's designed to project an image of a vigorous, popular leader pressing the flesh with adoring masses.
It is also a medically sound explanation for a patient on an anticoagulant.
But while they are directing our attention to the vigorous handshaking, they completely omit the explanation for the undisclosed MRI he required in October.
An MRI is just a scan.
An 80-year-old president does not undergo a magnetic resonance imaging exam just for the fun of it. Was it neurological? Was it an orthopedic issue with the spine?
We don't know, and frankly, it might be private.
Did it show right-sided heart strain, which would also explain the leg swelling? We simply don't know. The memo from Barbella stated that he had a comprehensive neurological examination demonstrating normal mental status.
Which answers the neurological question.
But it completely failed to connect the dots to that specific MRI. We are being fed the dietary fiber of a medical report without any of the actual clinical nutrients.
An MRI can be purely preventative or diagnostic for incredibly mundane issues, especially for someone with the executive branch's level of access to care.
Preventative MRIs are incredibly rare.
Not for a billionaire president. If the president of the United States has a sore shoulder or a tweaked knee from a golf swing, he gets an MRI immediately.
True.
The average citizen might wait weeks, start with an X-ray, do physical therapy, and then maybe get an MRI. For the president, it's step one. The mere existence of the test does not automatically imply a severe hidden pathology.
It implies a lack of transparency when the results are buried. If it was just a tweaked knee, why not say so?
Maybe he didn't want his golf opponents knowing his knee was weak. Furthermore, you have to acknowledge the thoroughness of the preventative care detailed in that same 2025 report.
I read the report.
They documented a July 2024 ultrasound of his carotid arteries showing normal blood flow. That is crucial because plaque buildup in the carotids is a primary driver of strokes.
Good. The carotids are clear?
They documented a colonoscopy that found diverticulosis and a single benign polyp, which is a completely routine expected finding for his age.
Again, routine.
They published his PSA level for prostate screening at 0.10.
Let's explain what that means for the listener.
Certainly. PSA stands for prostate-specific antigen. It's a protein produced by the prostate gland. Elevated levels can indicate prostate cancer
or a severely enlarged prostate.
Right, and 0.10 is very low.
A level of 0.10 is phenomenally low, essentially ruling out prostate cancer. They also published his exact hematocrit percentage at 44.7%.
The blood volume metric.
Yes, it measures the ratio of red blood cells to total blood volume, showing he is not anemic and has excellent oxygen carrying capacity.
Okay, but
My point is, the depth of the laboratory data provided is staggering. It is exceedingly difficult to argue they are hiding massive systemic failures when they are publishing blood work down to the decimal point.
that is exactly the illusion I am warning against.
Publishing data is an illusion?
It is the tactical deployment of overwhelming, irrelevant data to mask specific, highly relevant blind spots.
Irrelevant? Prostate cancer and stroke risk are irrelevant to a president's health?
Publishing a normal hematocrit level is easy when there is no problem with his blood volume. Publishing a perfectly normal PSA is easy when his prostate is fine.
So they only publish the good news?
Exactly. What about the things they actively choose to hide? When there is a potential problem, we go back to the COVID hospitalization. Why the refusal to discuss the specific lung scans?
Privacy.
We go back to the October MRI. What was the clinical indication for ordering the scan? We go back to the neck treatments in March of 2026. What exactly were they treating?
Actinic keratosis was noted in his past medical history.
Yes, which is a precancerous skin lesion caused by sun exposure. Was it that? Was it a basal cell carcinoma? Was it a melanoma? We don't know.
And we don't necessarily have a right to know every detail of his dermatology visits.
The precision of the data they do release is weaponized to make you feel as though you have the complete picture, precisely so you don't ask about the blank spaces on the canvas.
Look, the medical privacy of a president is not absolute, I agree, but it is also not non-existent. A patient is allowed to have a benign skin treatment on their neck without the world knowing the exact laser frequency or topical chemotherapy used.
But where is the line?
The line is functional capacity. What the American public fundamentally needs to know is whether the commander-in-chief has the cardiovascular endurance, the neurological stability, and the cognitive sharpness to execute the duties of the office.
And I argue we don't know that for sure because the mechanism of reporting is compromised.
But on those specific functional fronts, the data we do have is unequivocal.
It's cherry-picked.
He maintains a resting heart rate of 62 beats per minute in his late 70s. His lungs were clear upon recent examination. His motor and sensory functions are totally normal.
According to a doctor who praises his golf game.
He has maintained a perfect MoCA score over a 7-year longitudinal study. He possesses a lipid profile that many 40-year-olds would envy, achieved through rigorous adherence to modern pharmacology.
I don't deny the pharmacology works.
You can question the prose of the physicians, and you can certainly question the political maneuvering of the press office. But the core physiology of the man has proven incredibly resilient against both time and disease.
Look, I will grant you his resilience.
Thank you.
Surviving COVID-19 prior to widespread vaccination availability at his age and maintaining the grueling, relentless schedule of the presidency into his late 70s, it undoubtedly requires a robust constitution.
It really does.
But my core argument has never been that he is fundamentally frail.
Then what is it?
My argument is that the system of reporting his health is fundamentally broken. When a candidate dictates his own health letters,
The 2015 letter, yes.
when his staff raids a doctor's office over hair medication, when his military physicians use official letterhead to praise his golf game,
The PR aspect is messy.
and when major diagnostic tests, like MRIs, are buried beneath folksy anecdotes about enthusiastic handshaking, the public trust is eroded.
I see your point on trust.
We are forced to become medical forensic analysts. We're parsing adjectives and reading between the lines of press releases rather than receiving straightforward, unvarnished clinical truth.
Well, it seems we have arrived at our conclusion.
I believe so.
To summarize my perspective, I believe that while the delivery mechanism of this medical information has often been, theatrical, defensive, and undeniably shaped by political optics, the sheer volume of empirical evidence gathered by top military physicians over a decade cannot be entirely discounted.
You trust the numbers.
I do. The lipid panels, the cardiac stress tests, the stable MoCA scores, and his tangible survival of acute physiological crises paint a consistent picture. They show a man with remarkable physical stamina and stable cognitive function who is effectively managing the standard risks of aging through aggressive, highly modern medical intervention.
And to summarize my stance, the history of dictated notes, seized medical records, and deliberate misdirection during acute crises like the Walter Reed COVID-19 hospitalization renders the official narrative fundamentally untrustworthy.
A compromise methodology.
Exactly. The data provided may contain isolated truths, but the methodology used to collect and disseminate that data is hopelessly compromised. We know only what the political apparatus allows us to know. The frequent use of superlative, non-clinical language suggests these documents are drafted primarily for the ballot box, not the medical chart.
Yet I think we find a really interesting point of convergence here.
What's that?
Both of us agree that the intersection of presidential health and public disclosure remains a highly flawed, deeply subjective system.
Oh, absolutely. It's a mess.
The sheer stress endured by the executive branch makes these evaluations critically important for the public to scrutinize. And as we continue to parse the evolving nature of his 2026 medical reports, it is clear that there is much more to be explored regarding the delicate line between a patient's right to privacy and a public servant's duty to transparency.
Indeed. It forces us to ask a larger question about the institution itself.
Right.
Whether we will ever truly have an independent, verified mechanism for evaluating the health of our leaders, or if we will always be left staring at a muddy diagnostic landscape, endlessly searching for the truth hidden between the lines.
If you found this episode valuable, please like, subscribe, share, follow, and turn on notifications.